Hi, everybody. I want to welcome you to our first virtual meeting of the year. We're going to be getting started here in a minute. Would like to introduce myself for those who might be joining us for the first time. My name is Helen Hockey. I am the Executive Director for the Pennsylvania Coalition for Oral Health. And I'm going to be joined a little bit later here by our board chair, Jenny Engelerth, who is the CEO of Family First Health Center in York, PA. And so Jenny's going to be hopping on in a couple minutes and give you a little bit of information. I know we've got about 25 participants on the line already. We did have more than 50 individuals register for today. So I know we will have some handfuls of people joining in as we get started here. So for a little bit of background, this is our fourth year of offering virtual meetings. We know it's pretty difficult sometimes to make a trip to attend an all-day meeting in person, so we like to offer these brief updates semi-annually. As always, this meeting will be recorded and it will also be shared on our YouTube channel following today, so you'll be able to share it with others. If there's valuable information in here for you and you want to share it, you're welcome to do that. Or you can even go back and view some of the older meetings that you may have already, missed in the past. Some housekeeping as we get started. All lines have been muted, so that keeps the background noise to a minimum. Any questions that come up as we're talking, you are more than welcome to type any questions into the Q&A box. There should be a black bar on your screen for those who are joining by computer. And you can type any questions into that Q&A box. They'll pop up for us, and some of them we'll be able to address as they come in. Some of them we'll grab at the end, just depending on how everything's going with the presentation here. So for those who are joining by computer, you'll have the opportunity to participate in some polls that we put up periodically throughout the presentation. And for those who are just joining by phone and you can't see the slides right now, I will encourage you to go back and review the video and the slides at a later time. We'll send that link out for everyone who participates today, as well as the slides by themselves, so that you can click the active links on the slides. So we will go ahead and get started here. Of course, I wanted to start by mentioning all of our amazing supporters. We're very fortunate to have a lot of support from many corporate and community funders for our organization. So for those who might be new to PCOH, we are a registered 501c3 nonprofit, and we work within a lot of different grants around the state. But we also rely heavily on our corporate and organizational and individual funders to keep us moving on a variety of projects. So many of our funders have been providing annual support for many years, and we definitely could not do our work without them. So thank you very much to those individuals. And I will turn it over to Jenny on our next slide here so that we can talk a little bit about the leadership of PCOH. Jenny, I think you should be able to unmute, and
there we go. Thanks for the reminder, Helen. Good afternoon, everybody. It's great to be able to gather like this from hopefully all of you are gathered from some cool air-conditioned place and get to be updated on all the variety of activities that PCOH has currently on our plate, and even some glimpses into the future. I want to bring greetings from the entire board of directors. The slide shows you kind of who we are and those organizations and interests that we represent as we come to the table for this coalition. I want to take a minute to highlight two new members that have joined the board this summer. One is Lisa Davis, who represents the Pennsylvania Office of Rural Health. We feel very fortunate to have Lisa and all of her broad experience and perspective of joining the board. In addition, we had Jessica Rhodes join the board, who represents UPMC Health Plan. And Jessica not only brings her experience in care delivery, but also broadly in a public health lens. which will really add to the complement of expertise on our board of directors. I'd also like just to take a second to really offer sincere thanks from the entire board to Rick Selko, again from UPMC, and Michelle Mummert from actually a different segment now of UPMC, who both ended their board terms this summer and contributed greatly to the forming stage of PCOH. And I want to thank them for all their time and attention as PCOH was becoming a nonprofit organization. I really enjoyed working with them and appreciate their contributions. So that's it from the board, and would like to now turn it back over to Helen to start to walk through those activities that are our current areas of focus as an organization.
Thank you, Jenny. And I have to also point out, though he's been helping us for quite some time now, Dr. Halupa is also a new member of our board. And so just want to make sure that we acknowledge the breadth of knowledge he brings, not only as a dental provider, but also working with one of our managed care organizations in one of the rural areas of our state. So we've got a great team to move forward with, and it's pretty amazing that we can do so much with all of these groups and individuals. So thank you for our board.
Even with my notes, I knew I was gonna screw something up. So I appreciate, this is why we tag team, right? So we make sure we get everything covered.
Yes, we're just showing you guys that we're really authentic here. So as we'll move through the slides, I am going to give a little bit of information here. You know, for anybody who's new to the coalition and maybe joining us for the first time, we're going to try out our polling process today with our first poll. So Amy Plank, our ops assistant, is going to place the first poll up here. And basically just if for those who are joining us by computer, if you can just answer the question in front of you. Very simple question. Have you attended any PCOH event before? So we're going to leave that up for a minute here and give everyone a chance to click. And while everyone who's joined by computer is going to be answering that poll, I do want to just take a little minute to talk about what PCOH is and what we do. So many states have developed oral health coalitions over the last 20 years. The purpose of coalitions is to gather groups and individuals who are passionate about oral health and help them kind of communicate, work together, and also sometimes to implement some programming. Pennsylvania is part of the American Network for Oral Health Coalitions, which is a national network of similar groups. So we've got about 46 state oral health coalitions across the country. So there is even a website for the American Network, so you can go and see what other states are doing with their coalitions and find contact information for those groups too. Now, our coalition actually formalized in 2013 with the addition of staff and a more formal board structure. So just in the last 6 years, we've grown to over 800 stakeholders across the state. So we've got quite a good reach, and every stakeholder that we add really just helps to contribute to that reach and our knowledge base. So we're extremely grateful for everyone who takes the time to tune in and offer suggestions and help and assistance and participates in our meetings. So let's go ahead and see the outcomes from our first poll and see how many of you have already attended one of our events. And we're going to put that one up. Okay, so we've got a lot of frequent flyers. About 46% of you said you've been to many events. About half of you have said a few. And then we've got a handful that are just saying this is their first time learning more about the coalition and attending an event. So thank you so much for doing that. It's good to know that you guys, those who've been into a few things, are still sticking around. So we can go ahead and put that one down. And we'll start looking at some of the other information we want to share with you today. So one of the major projects that we work on in our state is that we assist the Pennsylvania Department of Health, their oral health program, in a variety of ways. So we gather data on some of the information that they need We try to review that data, review best practices, and then help to provide support as a subcontractor on a variety of items. So one of the biggest supports that we offer with them is working to ensure that our state has a current oral health plan. Pennsylvania went almost 8 years without a formalized plan, and back in 2017, that all changed with the creation of a 2017 to 2020 PA oral health plan. That plan sort of helps give direction to the state on the top priority focus areas around oral health. So the 2017 to 2020 plan focuses on 3 main goals, which would include access and education, workforce, and infrastructure. So we're happy to say we've met many of the objectives put forth in that plan already. We have a lot of work to do still. For those who were able to join us at our May spring stakeholder meetings in the eastern side of the state, you were able to hear a little bit about some of the work that's been accomplished on that plan. But we're always willing to talk and share information if anyone wants to reach out individually about some of that work. So one of our biggest accomplishments as a state over the last decade has been improving dental services for children, particularly those enrolled in Medicaid. Pennsylvania has a state health improvement plan, which we use the acronym SHIP for. So if you don't know about the SHIP, you can look that up on the Department of Health's website. And they track a lot of different health measures on the SHIP plan. So one of those measures that's actually, pointed out specifically is the number of percentage of children enrolled in Medicaid who have had a preventive dental visit in the last year. So for those who might not be familiar with the Children's Medicaid program, our state has a pretty robust dental benefit for kids through the Medicaid program, and most services are covered. There's approximately 1.2 million kids enrolled in Medicaid currently. Back in 2014, we only had about 42.5% of children 1 to 20 that had a preventive dental visit in the last year. So the SHIP plan set, a goal of 47%. That goal they wanted to reach by 2020. And we are thrilled to say that we blasted through that goal before the end of 2017. So we want to continue to see that number go up. And of course, our goal is that maybe 2019 could be the year that we see 50% of kids getting preventive dental visits. Sadly, we're not doing as well for adults in Pennsylvania. These data that you can see on the screen are pulled from 2 surveys that are completed within Pennsylvania through random sampling programs. Behavior Risk Factor Surveillance Survey asks adults if they've had a dental visit in the past year. Just the range there that you see is the rate of 69% said yes in 2012 versus 66% said yes in 2016. And that actually, when we look way back from 1999 on, we actually see that number that was hovering between 70 and 72% has now seen 2 sets of years of consistent drops. So we know our adults are not getting to the dentist enough. The other thing we look at is the PRANS data, which are kind of collected through a survey of pregnant women. And so one of the questions asked during that survey is, did you have your teeth cleaned during pregnancy? And we're starting to see those numbers drop a little bit as well. So we know we've got some work to do around adults, and specifically we have this data on pregnant women as well. So that sort of leads us to the next idea of, as we look towards our next state oral health plan, one of the things that we need to sort of look at is special populations and how to get more adults to seek dental care. So that being said, though we are very proud of the 2017 to 2020 oral health plan, we now have to start looking towards the future, and with the realization that 2020 is coming quickly, we're starting to look at the possibility of a longer term plan, at least until 2025, which could focus on similar priorities to 2017 to 2020, but maybe just a little bit more of a focus on aligning oral health services into community health. So that's something that we're working on right now. We've been gathering input over the last 6 months from our stakeholders and any other interested parties on what our needs for focus should be on the next iteration of the oral health plan. We've had surveys and had discussions at our in-person meetings, and we're going to continue to ask for input throughout this year, specifically this fall at some of our Western PA meetings, if folks are able to join us there. And we're always, again, happy to talk about these things at any time. We do a lot of one-on-one meetings and phone calls throughout the year too. So if there are specific priorities or areas that, once we start publishing some of our status updates on this, you say, well, we really need to work a little bit more on this, or we need to beef that up a little. Obviously, you can reach out to us at any time with that. So moving forward, I did want to talk a little bit about some of the funding that our state has received from federal grants. So in 2018, our Pennsylvania Department of Health Oral Health Program received grant awards from the Centers for Disease Control and Prevention, which many of you know as CDC, and Health Resources and Services Administration, which many of you know as HERSA. And those grant funds were to improve oral health programs and infrastructure in our state over the next 5 years. So we're now 9 months into these grant periods, and I want to give you a small informal update on some of the work that's happening. So first, we're going to focus on the CDC grant. This grant is actually very much focused on infrastructure, which includes school sealant programs, community water fluoridation, and then administrative infrastructure within the State Department of Health. So our overall goal over the next 5 years would be to add at least 10 new school sealant programs. We currently have 3 state-sponsored programs that are in about 40 different schools across the state. So we want to add at least 10 more to that number. And we've actually been working with Pennsylvania Association of Community Health Centers on that project. And we've now identified 11 schools working through 3 different federally qualified health centers in the state that are looking at possible implementation as early as this fall. So already made some great progress there. Community water fluoridation is obviously something that we're looking at taking the time to really develop relationships to improve the percentages there. So we're working with our community water operators from the systems themselves, attending water meetings, and then also giving some small grants out to authorities, boroughs, townships, water plants, anyone who is interested in updating equipment or introducing optimally fluoridated water for their customers. Those grants will be available for those groups. So that is our goal. So our 2018 number is that 58% of our state is fluoridated for those who are served by community water systems. So of course we'd like to see that increase by 5% over the next 5 years. Surveillance is a piece that we've missed a little bit on in the past. So when we talk about surveillance, we talk about sort of a state of the state. What data do we have? What do we know is happening? So we're looking at how we can help the Department of Health monitor that burden of oral disease. So with their program administrators within that department, they are working on a state oral health surveillance plan so that we can start tracking, establish a baseline of data and start tracking it, which should be available for everyone to sort of review fairly soon. So that's been quite an accomplishment for us. And then many of you know that we have struggled to hire a state dental director. So one of our goals under the CDC grant is to hire a state dental director in the first year of funding. So with that, the job was actually posted May 14th. It's still open right now, so applications can still be accepted. It is a job that is partially working through the State Department of Health as a state dental director and partially through the Department of Human Services as the chief dental officer. So it's sort of a shared position. And that job is open for dentists who are eligible for licensure in Pennsylvania. So I'm just giving you a little bit of background there. If you need more information about that, please let us know. And then that dental director will actually join our current PA Oral Health program which includes 2 public health administrators, a part-time dental consultant, and a part-time epidemiologist. So moving on to our HERSA grant, which involves quite a few more partners. We're working on a lot of different initiatives. One of the populations I mentioned that we have struggled with some populations in the past and getting folks to dental care. One of those populations, of course, is individuals with intellectual and developmental disabilities. So we have partnered with Achiva's Disability Health Initiative to work on not only just offering the training to dental providers about serving individuals with disabilities, but also to sort of give them a little bit of a push towards the reasons why we should do those things. So we should be announcing some things on that. We did a lot of sort of self-study and approaches to looking at what's available around the state for the last 9 months. So we're hoping over the next year we'll be able to do some more widespread work across the state. We're also looking at high school students and dental students to sort of point them not only towards dental careers, but also towards careers in public health. So we're working with the Health Occupation Students of America group from the state, and also with dental schools and dental hygiene schools in the state. So you can see we've reached quite a few students that way, and we are using, for those who are familiar with Mary Otto's book Teeth, that's the one we are using for our program. We're also looking at how to combine oral health information with obesity prevention and targeting agencies that have the best reach for these groups. So with that, we're working with the Pennsylvania Head Start Association. We've actually trained individuals from from 10 organizations so far, reaching nearly 250 individuals. And one of our other programs is the through being kind of guided through with the Pennsylvania Office of Rural Health, where we're looking at rural health clinics across the state that typically offer mostly medical services, and trying to encourage those groups to offer some dental services as well. So we have some small equipment grants available for any rural health clinics that might be interested in adding some dental services. And we are thrilled to say that we have one rural health clinic already on board through the St. Luke's University Health Network, and we are hoping that they will be seeing patients in the next couple months. So that's been really, really exciting. Then looking at the last of our programs through the HERSA grant, we've looked at doing some teledentistry models. So anybody who's been around any public health dentistry info over the last couple years, you've definitely heard a lot about teledentistry. The idea is that, you know, we can have a non-dentist provider working in the field that can connect a child or any person with a dentist on the other end of a video camera to offer triage services and to be able to save appointment times. So the idea is not that the restorative work can be done via teledentistry, but the idea is that for folks who might have access issues, transportation issues, and things like that, they would be able to save a few appointments by getting some things done on site and making a better plan for what to do when you do have to make that trip to the dental office itself. So what we're doing is working with Pennsylvania Head Start Association and the Erie County Department of Health with the Head Start group in that region. And to date, we've seen 89 children through this model, all up in the Northwest Pennsylvania area. And we have a public health dental hygiene practitioner who's working through the Department of Health up there and using the store and forward version of teledentistry, connecting those kids with a provider in their area that takes Medicaid. So it's been a great project so far, and we're looking forward to seeing that one grow. We're working with the Pennsylvania chapter of the American Academy of Pediatrics to start kind of doing some more work with WIC agencies. Their program has now reached all 250 WIC agencies in the state with oral health materials. And we're also developing materials for home visitors so that home visitors who are going in to visit with families would have some resources to offer around oral health. So that's a pretty amazing project as well. A little more infrastructure under the HERSA grant is to hire a public health program administrator and a dental health consultant, which those two things were already completed in the fall. So we're thrilled to have those folks on board and working with them already. And of course, overall, the goal of the HERSA grant would be to reduce the number of dental health provider shortage areas in our state. So we're starting to track those numbers through that oral health surveillance plan that we mentioned with CDC funds. So all in all, a ton of work happening. PCOH, in terms of our role with this, is to sort of follow it, track it. We work as the subcontractor with the Department of Health to help work with all of these individual groups. So with that, I do want to take a few minutes to talk a little bit about our priorities. So PCOH has 4 written priorities that we focus on. So I'm going to share a little bit of information about those things. I mentioned some of our projects with dental hygiene students, dental students, getting them interested in working more in the public health arena. We need private practitioners, but we also need a lot of providers in public health. And so what we have done is we have found that when we're looking at true pipeline programs and we're trying to bring people up to become providers in a certain area, like rural areas in our state, that we really need to identify individuals at high school level, sometimes even earlier than that, because we know that somebody from a community that goes on and becomes a dental provider has a much better chance of returning to that community later on to practice. So we can't just focus on our dental students, we also have to focus on the students who are even pre-college level. And then something else that we do is we try, because we have a lot of contacts throughout the state, is we do try to share information for open positions and connect people with finding providers or resources to find providers. We have an oral health webinar portal. So if you haven't been there, we've got quite a few continuing education courses offered through that portal. Some things are information only, some things are approved for continuing education. So there are materials that are meant to be shared with oral health providers, but there are also materials to share with groups like community health workers or even caregivers who work at home with patients. So some pretty nice resources there. We talk a little bit about the utilization of public health dental hygiene practitioners and ways that we can use all of our dental providers in the state to the fullest abilities that they're allowed through their scope of practice. And again, talking about matching up individuals with potential job opportunities and things like that. We also have to talk a little bit about loan forgiveness, and when we have individuals that want to work in a public health setting, we want to assist them in getting loan forgiveness if they're eligible. For those who aren't aware, I think the latest statistics for dentists graduating from dental school is that they have an average of $329,000 in debt. So if even, a fraction of that can be forgiven through doing some practice in a community health center, that's a good thing. So I did put our numbers from about a month ago for the number of providers in our state. And I did want to ask, because we hear this a lot, I'm going to have Amy put up our next poll. But for those of you who are joined by computer, let's see what you guys think. If you think that we are having an increase in dental providers in our state and a decrease in dental providers, or if it stayed the same over the last 5 years. So that's one of the concerns when we look at some of the reports, is we worry about providers retiring at a rate faster than they're being replaced, or we worry about individuals moving out of state. And so there's a lot of different reasons for provider numbers going up, down, or staying the same, and also the number of schools. So as we see the number of dental schools and dental hygiene programs fluctuate, that also affects the number of providers we're directly having in Pennsylvania. So I'll give you about 5 more seconds to finish up that poll. And then what we can do is we'll go ahead and take that down and put up our results and see what everybody thinks. see. Most people think that the number of providers have gone down. So we've got overwhelming 70% of those who participated said they have decreased, 13% said increased, and 17% stayed the same. So definitely a majority for the decrease. So I'm going to go ahead and we'll take that poll down, and I'm going to go to the next slide and show you guys a little bit of information here. So looking at strictly the State Board of Dentistry licensees, we do see a strong growth in our expanded function dental assistant populations. That number has consistently grown since first being licensed in 2010. And then, you know, we're starting to see, I would say, a gradual decline, both in hygienists and dentists across the state. So when we look at these numbers, we do see some fluctuation depending on where we're at in the licensure period, because a lot of folks don't come off the lists until it's time to renew and they choose not to. So the odd years would be the most accurate numbers to look at when we're talking about how many providers we actually have in our state. But I would agree with the 70% to say that we do see a general decrease, though it's not a very strong one. So just a little bit of one there. Okay, so we will move on to the public water systems that fluoridate. This is a map that we share quite a bit, and I think it's really, really important to share. It actually shows the community water systems that are fluoridated in Pennsylvania, and it's really helpful to see that when you look geographically, the majority of our state does not fluoridate. So even though we are at a 58%, we are still geographically missing quite a few areas. Then, when we move on to, that brings us, of course, to our second main priority as the coalition, which is advocating for community water fluoridation. So our statewide water action team is something that we started about 1.5 years ago, which consists of providing materials to organizations and groups that want to sort of be on the front line of alerting us when there's a problem. So we have magnets and flyers that we hand out and can be shared with community groups. And the idea is, and I should have my little swatch to show with you guys, that, you know, everyone gets a magnet. They can stick it on their fridge, they can stick it in their office, and if they hear any rumblings or problems with fluoride in the area, they're able to have somebody to reach out to. So it's a pretty neat program, and we've distributed over 1,000 magnets so far across the state and just ordered a few thousand more, so we're hoping to see that. Now, the water operator meetings, I mentioned that we're making a presence known with those groups. We're trying to work with boroughs, authorities, and water operators to make sure that they have a resource to turn to. One, we want to make sure that they feel thanked for what they're doing, because quite honestly, you know, the fluoridation of water is helping a lot more of this disease be decreased than even some providers are able to do. So we want water operators to feel that they really are valued for doing that. So we're establishing those relationships, and then we want them to come to us when they have questions. So if they hear something in their community that makes them question what they're doing, we want to be the resource that they're talking to, you know, rather than who knows who they would reach out to. As I mentioned, we are at 58% for our community water fluoridation levels. Now that's compared to a 79.4% goal of what Healthy People 2020 recommends at the national level. So we are still quite short, but we are improving and hoping to continue that way. I think I had mentioned at one of our meetings in the spring here that we are also looking at securing some funding to do a longitudinal study with 2 communities in our state that are similar communities in the northwest corner of the state. One who is initiating optimally fluoridated water and one who discontinued last year. So we'd love to look at those 2 communities and compare them so that we can see our benefits, expected benefits of community water fluoridation. Along with that, for those who may not be aware, we're having some upcoming training. Many dental providers, though they are advocates for community water fluoridation, they're not always well versed in the science of it and how to defend it. So if you have patients in your chair who are sort of questioning things, there's a lot of misinformation out there on the internet, and sometimes it helps to have a couple of those answers in your back pocket. So we are pleased to announce that the American Fluoridation Society is going to be coming to Pennsylvania to offer 2 trainings. And so we're going to be in the Pittsburgh area on July 10th and Lancaster on July 11th. These are 3-hour trainings approved for 3 hours of continuing education units, and will take place from 9 a.m. to 12:30 on those days. So there are links as we send these out. We can still take registrations for probably a few more days. So there will be links in the information we send out if you're able to make it, or even if there's someone else in your community that you think would benefit from taking one of these courses, we'll have that offered. So moving on to our next priority, which is looking at oral health policy and infrastructure across all systems. So really sort of that alignment, integration of getting oral health into a lot of the work that's happening. Looking at our school standards, our K through 12 health and physical education standards, so that we can hopefully implement some kind of required oral health piece to that curriculum. As it stands right now, there is no requirement in Pennsylvania for oral health to be mentioned in any of the K-12 health and physical education standards. So in health class, kindergarten, doesn't matter, there's no requirement to include oral health. And with the recent rise of looking at things like HPV and what we're seeing happen with younger kids in oral cancer, I think it's really, really important that we start talking about these things to these kids in school. That being said, school health records are always an issue as well. So we've been working with some teams on looking at school health records, what's included around dental, which also then leads to the dental screening process. So we have a mandated dental screening program in Pennsylvania. So there are 3 different grade levels that kids must have either a private dental exam or have an exam done at school. So trying to make sure that parents aren't under the wrong impression that counts as a dental visit for their students as well. So that's sort of something that's been a goal of ours to get changed, and we continue to work on that. Looking at CHIP, many of you guys are probably familiar with the children's health insurance that is offered for families who maybe aren't offered benefits through other sources, and it is a sliding fee scale for the CHIP program, so parents pay what they can afford for insurance. One of our big issues is that dental insurance cannot be offered as a standalone through the CHIP program, and we have confirmed through a couple different sources that federally it is fine to do that. So our state could actually opt into offering dental-only insurance, so that if a child is covered by their parents' medical insurance through an employer, they could just get CHIP dental as a standalone. Our state has some different rules on the books that are making that a little more difficult to implement. So again, we'll be looking at the insurance company law at the state level to see what we can do to hopefully make that change soon. And I mentioned the public health dental hygiene practitioner scope. There's a practice setting regulation change that's working its way through the State Board of Dentistry right now, which would allow the public health dental hygiene practitioners to do some work in medical offices and child care centers as well. So we'll put that something out going on there. Now, moving forward here, and I know we have some questions coming in, but I'm going to wait till the end just in case I cover anything as we're talking. So I'm going to finish up in the next couple minutes, and then we'll have some time to hit those questions. So looking at some other legislative updates, and for those who are more interested in learning more about some of these, you can go to the PA General Assembly website and look up any of these bills. But these are bills that are more pertinent to dental right now that are moving their way through the legislature. So we've got a couple telemedicine bills out. The loan forgiveness bill is actually a pretty interesting one. It's essentially would double the amount of funding available with an increased time commitment. So currently dentists can receive $100,000 in loan forgiveness for serving 2 years at a community health center. This would double that to $200,000 loan forgiveness and offer them, increase the time that they would have to serve at the community health center to 3 years. So that would be, I think, a great thing for our state to have take place. Looking at, I mentioned the mandated school screenings. There is a bill right now, House Bill 994, which would permit the public health dental hygiene practitioners to complete those dental screenings in addition to a dentist. That's been committed to the Rules Committee, I think just in the last week or so. It did pass through the Education Committee about 2 weeks ago. A newer one that has come in is the Dentist Retention Student Loan Forgiveness, which is actually, I believe, a direct loan forgiveness funding amount through FIA. So it's different than the other available options. So that's one to kind of keep an eye on and see where it goes. And then the Assignment of Benefits bill is still out there, which basically allows for the patients to be able to assign payment directly to their providers and streamline that payment process. So those are a few of the things that are out there right now. Looking at our last priority, this is something we've got a lot of things going on around. Of course, many of you know that our adult dental benefit under Medicaid was cut to basic benefits in 2011. So we are working with a national network of partners and some state partners on trying to restore those comprehensive benefits. So right now we're actually looking if anybody out there has an organization or even as an individual would like to learn more about that work and possibly join our advocacy team. We're going to be having an intro call sometime in the next month or so to give some more information. So if you haven't been getting our emails, you will now, and you will hopefully get to see some information about when that call is going to be posted. And something new that we found out from our managed care organizations is that the state is now going to be calling for some adult performance measures under Medicaid, so that we will actually be tracking the number of adults who seek dental care, which is going to be really, really great, and will give us some data to work with. Another project we're looking at is a state dental access coordinator, trying to find ways, because we have so many individuals that are seeking dental care and they don't know where to turn. They may not know that there's a free clinic in their area, or they may not know what an FQHC is, or that they can receive services there on a sliding fee scale. So we really want to set up a system where we're not just putting a widget on a website where we go and we log in and we see that this group takes Medicaid, but maybe they don't see kids under 2, or maybe they don't see folks with intellectual disabilities. So we want to try to set up a really good coordination system so that people have a place to turn to find real resources for them. We continue our work with the Family Oral Health Collective, which consists of the Pennsylvania Head Start Association, the American Academy of Pediatrics Pennsylvania chapter, the Association of Community Health Centers in Pennsylvania, and the Pennsylvania Office of Rural Health, and we work on a lot of different family initiatives. You heard about some of those before when we talked about the HERSA Grant, and we received some funding under the DentaQuest partnership for that as well. And then our last kind of thing about, under this priority is our charitable work tracking project. We developed a survey so that we could collect information on the free work that's happening in our state. Because you really can't ask for more allocation to a problem if you can't show that there is a problem. So one of our things that we've been working on is trying to track those free dental services that are done in Pennsylvania. So we just published a survey in May, just this past, about a month ago. We've received only 19 responses so far. But with those 19 responses, we've actually collected data that $4.09 million worth of services were done in 2018, just from those 19 responses. And for those of you who work directly in the dental field, you know there's a lot more free services happening than 19 across our state. So we're really, really excited to continue watching this project, and we hope to have a full report put together by the fall of exactly how many services were really provided in 2018 on a free basis. So that's a pretty exciting thing, and we'll be rolling out that survey to more groups sort of after we were test piloting it for a while. I did want to make mention of a group that we work with, the Open Oral Health Progress and Equity Network. For those who might have been a part of the Oral Health 2020 network in years past, they've revamped and rebranded, and now this is a national network of folks who are interested in oral health care. Over 1,700 individuals and organizations are a part of this network. So we encourage anyone in Pennsylvania that wants to know more about sort of national happenings and be connected to some things that are happening in other places to join Open. It's a really great resource, and I will give you guys, the next slide here has the website where you can join. When you go to Open, to the website, all you have to do is go to this little box at the top that says request login, and I will circle that right here for you guys. There it is, all the way up at the top. When you go to request login, you'll get to set up your own login and you will be part of the network. There are state pages, there are topic pages, there's just so much information on here, so I highly encourage anybody who wants to learn more about some of those things to join Open. It's really great resource. They do a lot of webinars and information, things like that as well. So very, very cool. Okay, so now as we wrap up with this part, and we'll get to the questions, I did just want to mention a couple of the upcoming dates. So if anybody has had some extra additional questions, you can start typing those in too, and we'll make sure we have a few minutes to answer those. But I mentioned our fluoridation training, those dates are listed there. Our next in-person stakeholder meeting, so when we gather everybody together in a room and work together on issues, will be in Western PA in September. So September 18th in Altoona, September 20th in Butler, and then we'll do another one of these virtual meetings in December. So that'll sort of be the year in review wrap up. Looking at some dates that are non-PCOH events, but that you might still find helpful. You may be familiar with the Mission of Mercy events that take place. I know we had our state Mission of Mercy in the Wilkes-Barre area about 3 weeks ago now, and they were able to see, I think, 1,800 patients, which is pretty incredible. It's a 2-day pop-up clinic free of charge for anybody who needs care. So the Pittsburgh Mission of Mercy will be taking place on July 26th and 27th. So I know that they are still really seeking dentists to volunteer for that mission. So if you're a dentist or if you know a dentist, please, please, please consider volunteering for maybe a 6 or 7 hour shift just to really help out. They want to be able to fill as many chairs as they can. The Pennsylvania Association of Community Health Centers will be having their Medical Dental Integration Summit in August, so that's on there. Some national events, and then PAC's annual summit in Lancaster is there as well. We've got the Open convening in Baltimore. We've got APHA, which is the American Public Health Association, coming to Philadelphia this fall, which is amazing. And if you're interested or you work with Head Start populations, the PA Head Start Healthy Smiles Task Force meeting, their next one is in Allentown on November 7th. So some really great, interesting events coming up there. We also keep track of all of these. We have an events calendar on our website. So if you ever want to look ahead and say, I wonder what's really happening around in oral health, or if you have an event that you want us to add to our calendar, please do, because we really want that to be a resource for individuals. Our social media is going strong. For those of you who are on Facebook or Twitter, please feel free to follow us. We send out a lot of newsletters, but we also put a lot of stuff on social media that doesn't always make the newsletters. So if you are getting our newsletters and following us on social media, then chances are you're pretty well informed. So we've got that, those links there will be live on the slides that we send out, and also a link to our Amazon Smile. For those of you who do shopping with Amazon Smile, it's a really pretty cool program where they donate a percentage of anything you buy on Amazon to our coalition, which is great. So just letting you guys know that that's available as well. And then I will go to our Q&A here, because I know we had a couple questions come in. So the first question, if the number of dentists are about the same, what about the population of the state? If we're increasing in population, that would mean less people per provider. And yes, I believe, if I'm remembering correctly, for the time frame that I showed on that slide, we've increased about 200,000 to 300,000 people. So I think we went from 12.5 million to 12.8 million. So yeah, I would say that it does mean that the ratio is changing with more people in Pennsylvania. We are now, for those who don't know this, we are now the 5th most populous state. So that's pretty big. As we say, we're a small country or a medium-sized country, and so a very diverse state. And yes, so the population, as those providers go down and our population goes up, it is going to make the need higher. And then I see we have a question about mandating children be assigned to a dental home upon enrolling in a Medicaid plan. Many states have this as policy. And that's really interesting, because it is one of those situations now where when kids are enrolled in Medicaid, they're able to choose their plan, they're able to choose a provider. But a lot of times they have a really difficult time finding a provider. Either the ones in their area may not participate with the managed care organization that they're signed up with, or they may not be taking new patients, or they may not see kids under 4. There's a lot of different reasons that runs into trouble. So I think that is certainly something we should keep in mind as policy, and something that we will probably be discussing with the new state dental director when that person is hired. So stay tuned is what I will say on that one. And let me just see, I know we saw a couple things come in through the chat here, but I think we've got that all handled. Okay. And so are you referring more to dentist Medicaid providers or PHDHP medical providers? So we had a question about, is there an update on the number of Medicaid providers? The number of Medicaid providers is a tough one. When we look at the list that comes from the Department of Human Services, there are about 2,200 dentists that are registered with the Department of Human Services as a Medicaid provider. When we look at those numbers closer, we may have individuals who, again, like I mentioned before, aren't taking new patients or aren't seeing certain populations, or we have individuals who maybe are registered with DHS but aren't credentialed with any of the managed care organizations, which means that they really can't see very many people. So I would say when we look closer at some of those numbers, we have the 2,200 providers listed in the state. Maybe 80% of them are actively, providers that we can get to. So that makes it tough. And then, and the Take 5 plan. So when the Take 5 plan PDA put forth, which was a really great idea, so that every dentist could just take 5 families, participate with Medicaid just to take 5 families. It's been a little bit difficult to get that launched. So, it's still an active program. So if anyone's interested, we can certainly connect you with that. And then I know in terms of the idea around the PHDHPs, the public health dental hygiene practitioners can now be credentialed with the state, with DHS. They can get a promise ID, but then they need to credential with the individual managed care organizations as well. And there are only a few of the managed care organizations that are currently credentialing PHDHPs, but it is possible, and we actually have had some PHDHPs now being set up and fully credentialed with MCOs. So we're starting to see that shift a little bit, and we're starting to use that provider type in a different way. And the question of any update on PHDHPs working in schools, nothing has changed in the school law. So hygienists can still work in schools as a certified school dental hygienist by getting an emergency certification and following the same standards that they've had to follow for the last few years. So that is something we're still tracking. So any other questions? Anybody else have anything else? I know we're getting close on time, so I want to be mindful of everyone's time and make sure we don't run over, but if there are any more questions that want to come in. And I'll give it another minute here. As a reminder, we will be sending the recording out along with the slides following today's meeting, so you'll be able to go back through and review and share this information as you need to. So I'm not seeing any more questions come in, so I will say, guys, we're going to give you back 5 minutes to your day, and we hope to see you back in December if we don't see you sooner. All right, so thank you very much, everyone, and hope you have a great day.